Thank you. So next, I would like to introduce Dr. Kaushik Sarkar, sir, the Director of Institute for Malaria and Climate Solutions. Throughout his career, sir has been working on harnessing the power of data to find new angles of viewing global health security and access problems and designing strategies to solve those problems using new tools and technologies. In this journey, sir's most recent work focuses on making the innovations in artificial intelligence and digital transformation accessible to the army of global health practitioners and health service providers in low and middle income countries. With this brief intro, I would like to welcome Dr. Kaushik Sarkar sir to talk on artificial intelligence and personalized healthcare. Over to you, sir.
Thank you so much, Venkatesh. And I apologize to everyone, including Venkatesh yourself. So basically, some of you might have heard the Delhi fog today and the flight delays. And my flight got delayed by about 4 hours or so. And I'm still in the cab, so can't come on the video. But please bear with me. I believe we will have a little bit of background noises, but definitely I'll try to deliver an exciting session. So my topic in today's paradigm of discussion is primarily focused on artificial intelligence and primary healthcare, personalized healthcare. So as you are aware, there is no one size fits all in medicine and healthcare. And traditional approaches of medicine and health, can customize care to a certain limit. But that often comes at the cost of unstandardized practices and very much subjective decisions from the care providers. Let's think of a situation that a patient attends a clinic with fever, and now you may have created a fever care algorithm for your clinic or your hospital, or if you are a practitioner, if you are following an algorithm that has been developed by an expert committee or a professional body. Now, the problem is that the algorithm is efficient to a certain granularity level, but it will not be efficient enough for every single patient. And that is the reason that for every single patient, you need different algorithms because their genetic makeups are different, their care processes are different, and their biochemical parameters are different. And even with the same medicine and same types of care from same status, their prognosis trends are different. So what happens is that, patient A, which you are treating because of one symptom like fever, when that patient, when you are providing treatment to that patient may have different accompanying symptoms and signs, different progression of diseases than patient B. And when you are following, manual algorithms, it is almost impossible to do customization to the exact precision level. That's the challenge of traditional medicine or traditional healthcare. Now, personalized care is a rapidly evolving field, where we have seen that previously there were, prescriptions like flowcharts or others. Then there were more precise algorithms. And then there were a lot of solvers that were used. Unlike traditional approaches to healthcare, personalized health interventions are designed to take into account factors such as persons, genetics, environment, and lifestyles. Now, examples of personalized health interventions include, precision medicine, which uses genomics and other data to identify the most effective treatments for a particular patient, and wearable health technologies such as fitness trackers or smartwatches, which can collect data on a person's activity levels and health status. So, and there has been immense improvement in recent past. So for example, previously you might have heard that you could track your sleep patterns from your smartwatch. Nowadays, you can even have a lead to ECG or a long lead ECG from your smartwatch. Now, in general, in this situation, what is the role of AI in personalized health? In short, AI is playing a significant role in the development and delivery of personalized health interventions. For example, analyzing electronic health records and other data sources. So when you are dealing with personalized health records, in case of health facilities or public health programs or even hospital setups, we are talking about big data. We are talking about hundreds and thousands of lines of data. And by analyzing vast amounts of data from electronic health record, clinical trials, and other sources, AI algorithms can identify patterns that may not be apparent to normal human analysts or even expert physicians or practitioners. This can help to predict a person's risk of developing a particular condition and to recommend interventions to prevent and manage that condition. Developing personalized intervention and treatment plans and recommendations. So now, so far we talked about predicting the risk. And now you need personalized treatment plans. AI algorithms can and are analyzing a person's medical history, genetic data, other relevant information to generate personalized treatment recommendations. For example, an AI system might recommend a particular medication or dosage based on a person's specific characteristics or needs. We still have a long way to go to a point where an AI doctor can become your assistant. But in today's date, the status of AI is that an AI can definitely become an assistant of a physician, if not a patient. The third piece is monitoring patient, which is really critical in terms of remotely, managing patients remotely and alerting healthcare providers. And we have seen in recent years a lot of issues related to the doctors are not available in the middle of the night. They should be sitting there. How can you avoid those problems if you have a wearable technology, if you have AI algorithms and monitoring devices? It will more efficiently, because AI won't slip. Your midwives may slip. Your doctors may be dizzy, but AI won't slip. So create an alarm system, and AI is more efficient than any human in terms of doing that part. So monitoring and alert. And improving the accuracy of diagnosis and treatment recommendations. So, which is happening for a very long time now. Now, what benefits, we already heard that there are a number of benefits of artificial intelligence there. Now, there are a lot of challenges as well. And the challenges are there because AI in today's date is doing repetitive tasks very well. But AI in today's date cannot do very well solver problems and others. So ensuring the accuracy and reliability of AI algorithms is the quintessential job of the AI researchers these days. So they need to make higher quality of models and validate those against stringent criterion and all. Another big challenge that AI is facing, especially in this particular field, is data or access to data. The more data you have in any AI development, your model would be better. I mean, that's a norm. There are exceptions to that, but that is a big norm. Now, the problem is that healthcare data is private data, or healthcare data is secure data. So there is a trade-off between security and the privacy and the accuracy of the model that you develop. So when you are trying to play between those two endpoints, that at one point you cannot have access to a lot of private data, But at our point, you need a lot of data to create very accurate models which can actually which can actually behave like more or less like humans. So there are ways these days where AI are generating, synthetic data them itself. So, GAN is one of those technologies which can generate synthetic data. So these type of technologies in future will overcome some of those problems or challenges. And finally, overcoming the biases and the ethical concerns. So one of the bias that I typically see is that when you are training an artificial intelligence model, the biggest problem is that the class of data which predominates gets more accurate results. So for example, let me give you an example. So you have data of women and data of men of heart attacks. Now you are trying to predict that. And let's say that the number of women data or number of women data records are lesser than male data records. What will happen is the model that will be generated will be more accurate in terms of predicting male heart attacks compared to female heart attacks. And that's the kind of bias that gets generated from the model itself. Apart from that, there are several ethical concerns in terms of data sharing, in terms of data privacy, in terms of the the perpetuate inequalities, some of the inequalities Dr. Archisman was talking about, and especially in the lower middle income countries, you don't have internet, we are talking about artificial intelligence. So we don't have smartphones to everyone, and you talk about AI. So these are certain things which still make the marginalized more marginalized. So we should focus now on more on the marginalized people, how we, in spite of limited access, we can make this AI usage for precision medicine or precision healthcare, and the solution should be strategized accordingly. Apart from that, I just want to end with the fact that all of the big technologies are moving into the healthcare. So stay tuned, look for those technologies, embrace those technologies, but don't cut the corner ever, because medical field needs more accuracy, more precision, and the cost of failure or cost of false alarms, cost of false predictions, cost of false recommendations are very high. So let's not cut the corners. Let's create more stringent regulations. Let's be a little cautious, but embrace those technologies, because they will change the game they have started changing the game, and they will change the entire game of diagnosis and treatment in the coming months. So thank you, everyone. I know this was a monologue and without a video, without a presentation, and thanks Venkatesh again for putting my website down there so that people don't get bored. Thank you so much, Venkatesh. Thank you, HeDaL and IMA and Clarnet. I really apologize for being stuck on the road just till now, but thank you.
Thank you, sir. Thank you so much, sir, for the excellent talk. Though you didn't project slides, you kept the talk very engaging and thought-provoking.